Hello, hello. My name is Medina, founder and owner of shoppershesaidhesay.com. I wanted to come on here because I was speaking to, and I hope everybody is having a wonderful day. But I was speaking to someone earlier in regards to diabetes, and I wanted to something that I was talking about earlier was that. Lord, y'all, I'm supposed to be going on vacation. I'm trying to come down with something, but I'm going to rebuke thee in the name of Jesus. I am healed. He said through his stripes, I am healed, because I do not want to be feeling bad while I'm on vacation. But he was someone who was experiencing diabetes. He has type 2 diabetes, and I was helping him out today. And I wanted to offer a resource that I think would be beneficial for a lot of people that helps out when it comes to type 2 diabetes, because as some may know, insulin is very expensive. A lot of times your insulin is what helps you meet your co-insurance amount, that you have with your insurance. And also something that I was talking to him about was looking to see if the pharmacy offers delivery, because he said he had some issues with transportation. So they did. They actually came today, which was great. And also, man, it is so many things. If you have commercial insurance, or even if you have Medicare Advantage insurance, it is so many resources that is offered to you at no cost. Welcome in, everyone. If I don't see you and I don't speak, I do apologize. But welcome in and thank y'all for being here. But if you have commercial or Medicare Advantage coverage, it is so many resources that is available to you, such as case management for chronic diseases, multiple chronic diseases, specifically for maternity or oncology and diabetes. And so it's also important to reach out to your insurance, because and I'm taking a deeper dive into this. And so I hope I don't lose anyone, but I want people to, I'm very transparent, because I've been a registered nurse now. This year, July 13th will be 11 years, but I've worked in managed care for a long time. Hello, everyone, checking in from Mississippi, having a great evening. Hey, Mary, how you doing? Thank you. And something when it comes to if you have commercial insurance, you have your employer who signs a contract with the insurance company. Okay. Your employer determines what they want covered for their employees, because sometimes we'll have members call and they'll be upset and say, well, my friend has this and my friend has that. Well, your friend may not have selected the right plan, or may have a whole different type of plan based on their employer. So it starts with that first. So your employer is the one that determines what your deductible is going to be, what your co-insurance is going to be, what your copay is going to be, what's going to be covered, what's going to be pre-authorized or prior authorizations. Your employer determines that, not the insurance. So when people call in and be upset with the insurance, it's not us. This is what your employer wants, as far as their costs to be. But something that they don't tell you a lot of times is the programs that are also offered at no cost to you. And a lot of times you don't know that until you have some form of procedure or have to be in a hospital, something like that. Then you find out what's offered to you. Can I show you some things? Not right now, love, but at the end of the day, it's your employer who makes that determination as to what's going to be covered and what's not going to be covered, and so forth and so on. And so I would encourage, if you are someone who is struggling to manage chronic conditions, when I say chronic conditions, I mean, you may have diabetes, hypertension, high cholesterol, COPD, those kind of things. I would encourage you to reach out to your insurance company and ask them, do they have long-term care case management services or case management services, period? Or do they have diabetes navigator, COPD navigator services, something like that? Because with this, you would be most likely have a registered nurse or a licensed practical nurse, or a diabetic specialist or dietitian who is certified to assist you. But a lot of times you don't know that because they don't make that broadcast. So when we call, it's like we're cold calling. And I have a lot of members. I'm a registered nurse case management, and I work with transition of care program. Transition of care program I used to work in long term as well, but transition of program is more focus based. So let's say you were in the hospital when you get discharged, you become eligible for the program, and it's no cost to you. And what that involves is a registered nurse reaching out to you 4 times a week to check in with you, making sure you're doing well, you got your resources, you got your health education or overall support. And some people agree to the program, some people don't. But a lot of times they'll say, man, I didn't know I had that. Thank you for letting me know. Now I know moving forward. And then I let them know you also have long-term care management. You got a whole lot of resources, but these commercial companies don't always advertise them. And so what I want to do and what I'm going to do is on a weekly basis, bring a topic to the table related to your health. Hey, Ansley, how you doing, love? And welcome in, everyone. And I want to be able to talk about these things because I think that it's important. And I'm also going to start being more consistent with it because I think it's important. But the first thing I want to talk about, I'm going to talk about diabetes, but I'm also going to talk about migraines as well. Okay. Because that is something that I have noticed that a lot of people have been suffering from. Me, myself, I suffer from migraines as well. I've had migraines all week. I've had migraines. I had one today. That's why I'm looking like this. My eyes look a little sleepy because I take Firacet, and Firacet have a little sedative in it to help, dilate, and constrict. And so it ain't no fun. The one I had earlier in the week was, woo, my God, today. But I'm here, thank God. But I want to talk about just provide a resource for diabetes for the peoples, okay? There is a program called Lilly Insulin Value Program, okay? That's just one program. Now, as I continue to do this on a weekly basis, typically it'll be on Wednesdays, probably around 6 p.m. But if you're not able to attend, don't worry. I will be posting those lives on my other social media platforms, which is Facebook, Instagram, and YouTube. So you'll be able to check those out there. And my objective of this is to bring awareness. And I also want to encourage people to help them to be empowered, to be motivated in their health. It starts with you. When it comes to your health and wellness and maintenance, it starts with you. And so I want to be able to, as a registered nurse, just empower people, give them knowledge, and also have dialogue as well. And so this is why I'm actually doing this. But I found a really good resource that I actually give to members when it comes to diabetes. Now, of course, you have the American Diabetic or Diabetes Association that helps out. But this is a program that I found, and it's called Lilly Insulin Value Program. And what I'm going to do right now, I'm going to actually bring up the information. So I'm going to get quiet for a moment, but I want to bring up the information so you guys will have it and you'll be able to see this. And this is in regards to insulin, because insulin is very expensive. Okay, let me move out the way. All right, I'm going to move out the way. So this is the program here. It's Lilly Insulin Value Program, $35 a month insulin, helping people with diabetes get the medicine that they need. Okay, and they are committed to helping people with diabetes access affordable medication. Okay, this program again is available for $35 a month, whether you have insurance or not. This is very important because there are a lot of resources that offer assistance for diabetes, but only for people who don't have insurance. If you have insurance, you don't become eligible. And so it's important that when you receive resources regarding any type of any kind of chronic disease, to read the fine print. Because a lot of times, and I've had this too, I've had members call me and say, I got this thing, but it ain't working because they're saying I got insurance, so I'm not eligible. Did you read the fine print? So this is why this Lilly is very important, because it doesn't matter if you have insurance. You still can be eligible to pay $35 a month, whether you have commercial insurance or no insurance. That is very important. These savings cover all Lilly insulins. Okay. Now let me go ahead and pull up the next thing so you all can review this as well. And remember, if you're just coming in, education to the people. Now, here is what to do. These savings cover all Lilly insulins. You're going to download the savings card. You're going to print it and take it to the pharmacist, and then you're going to receive your discount. Okay. Now, the website is, I'll pull up the website for y'all so y'all can have it. But there's only 3 steps that you got to do to get the insulin that you need. But you will need a prescription from your doctor. Okay. This is what this is. You can't just go there and say, I want some insulin from Lilly. You got to have a prescription from your doctor. All right. Now, this is the next thing I want to show the peoples in regards to the insulin. Let me go up here. All right. Now, I don't know why I did that, but I did something right here. So, commercial insurance savings card. Pay attention, y'all, because there's 2 different ones. You got the commercial insurance savings card, but then you just got the savings card if you just going to pay out of pocket because you don't have insurance. And look at this. It's good for up to 12 calendar months. Y'all see that? Patients must have commercial drug insurance to pay as little as $35 per month for the prescription for a 30-day supply of your covered insulin, okay? The offer is subject to a monthly cap of wholesale acquisition, cost plus usual and customary pharmacy. I done highlighted something or whatever, but I'm going to give y'all a website so y'all can look into this a little bit more. But this is right here is for the commercial insurance, all right, that you can actually do, that you can actually get your insulin from, okay? Commercial insurance. Commercial insurance is Cigna, United Healthcare, Aetna, Blue Anthem, Blue Cross Blue Shield, who else? Optum, which is under United Healthcare, Capital Blue Cross, Blue Cross Blue Shield of Tennessee, Blue Cross Blue Shield of North Carolina, Molina, I think it's Molina Insurance. It's multiple insurances. That's what commercial insurance means, okay? Not Medicare, Medicaid, commercial insurance, all right? Now, this next one I'm going to show y'all is additional information for people who are paying with the cash. Here we go. Now these are for people who don't have any insurance. You're going to have the cash savings card. The offer is good for up to 12 calendar months. Patients pay as little as $35 per prescription per month for a 30-day supply of your covered insulin, okay? And then please read the additional information so that you can understand everything that's going on. So the reason why I'm bringing this to play, like I stated, and welcome in everyone again, is because this program, Lilly program, offers assistance for $35, whether you have commercial or whether you have cash and you don't have any insurance. So this is what's very imperative, and this is why this is a really good resource to actually use. Let me come on out of here right quick, because and what you can do is look up Lilly Insulin Value Program. Google Lilly Insulin Value Program, and it's going to provide you that information, okay? It's important to read the fine print so you have no surprises. Read the fine print. But that is something I wanted to talk about. And there's going to be other conversations that I will be having when I do my health and wellness. Thank you so much, Ansley, for putting that in the chat. Hey, Royal, how you doing? Hey, Mary. Let me see who I'm missing. Hey, Love Strong and Bewilder. How y'all doing, love? Carolyn, I appreciate y'all coming in. And so this is the things that I'm going to be doing to bring to the forefront or whatever, because I just think it's important. I'm a registered nurse. I love dealing with health education. If you don't want to hear it and you don't want to listen to it, that's fine. Just take the 10 fingers and the 10 toes that God bless you with and swipe on up. You understand? That's all you got to do. It don't matter about who's in here or who's watching in the sky. I'm just trying to provide education and knowledge for the peoples, okay? And so this is why I provided that. But again, there are other resources for diabetes, but I'm going to get into those at a later time, all right? All I ask is that when you Google information that you just make sure that you're Googling credible resources, because there's so much on the internet, and it's come to a point where anybody can write anything without any kind of proof or any kind of validation. So you want to make sure when you look up things, you're looking up .edu, .org, .gov, those kind of things to give you information. My resources are coming from the North Carolina Nursing Association, as you can see here. Let me show you right quick. This is the American Nursing Association, all right? I am a member of the American Nursing Association, and I am a member of the North Carolina Nursing Association, okay? Tar Heel, North Carolina. There you go. Just want to show you proof. People want receipts. North Carolina, right there. You don't need to see my address now. I ain't got to see the address, but I try to show you my name right here. Hold on. If y'all can see it, there you go. That's me. So I'm a member of both. And so this is where I get my knowledge from. This is the information that I use along with the information that is given to me by my employer to provide to my patients. And I'm always going to give you valid information, okay? It is my duty and my oath to be ethical and honest, and I'm always going to do that. If you ask me some questions and I don't know, I'm going to say, I don't know, let me look it up. That's how you do that, okay? But I'm always going to use credible resources. Now, I got my American Nursing Association, and the first thing that it talks about is migraines in adults. And I said to myself, man, I always have migraines. So what's going on? What's new? Is it something new going on? What's happening with the migraines? Because when I tell y'all, these migraines ain't no joke. These migraines ain't no joke. And I'm going to tell you something else that ain't no joke. Heart failure. We're going to talk about that too. Not today, but we're going to get into some things. Heart failure, okay? What I want to do and my objectives, and I'm going to always do this in intermittently. I want people to be able to be motivated, to be honest with themselves. Most importantly, honest with yourself. Take acknowledgement and take ownership of the part that you are playing in your sickness. Okay? Because people are easy and quick to make excuses for things. And the next thing you know, you're laid up in the hospital, or you just might be going to the grave. You got to take ownership and acknowledgement in the part that you are playing in your health. Are you doing what you're supposed to be doing? Are you eating healthy? You understand? Are you actually asking the questions to the doctor to get the answers that you need that's going to benefit you? Are you fearful to talk to the doctor because the doctor may be of another ethnicity? Okay. It is statistically known that as Black Americans that we tend to listen better when we have a doctor that's the same, ethnicity. Okay. But that's not always the case. I'm going to tell you, both of my doctors, my primary care doctor and my gynecologist and my ophthalmologist are all white. But I have a great relationship with them. You know why? Because I ask questions. I hold them accountable. I don't just let them tell me anything. I come without any fear. I come open to be able to ask questions, allow them to ask questions, and we have a dialogue and a conversation. And so something that I also want to teach everyone is called motivational interviewing skills. This allows you to get the in-depth answers to your questions. I want to be able to teach you all how to ask the appropriate questions to be able to get appropriate answers. I want to empower you guys. So when you go to the doctor's office and you say what you got to say, you're saying it in a way that it's going to be received, but you're also going to get the information that you need. Okay. So these are all things that I'm going to be discussing over time. And I thank you guys for being here and listening. And I hope you all continue to listen and continue to share. But sharing isn't mandatory. Liking isn't mandatory. I just want to provide this information, and I'm going to spread it across the platforms, and whoever get this and listen and be able to apply it, that's all I need. You see what I'm saying? Amen. Amen. So I'm going to go on to the migraines right quick. What it say? Adult migraine, more than a headache. Accurate diagnosis and treatment require an interprofessional team approach. Let's see what that's talking about. Let me go on over here to the page 18, because Lord knows I need this. I need this, my God, today. Now, what this says is 3.5 million. In the United States, 3.5 million emergency room visits annually. People have went to the hospital for migraines and headaches. Let me say that one more time. 3.5 million in the United States went to the emergency room annually for headaches and migraines. That means that this got to be dealing with some kind of tension. It got to be dealing with some kind of stress or something. You see what I'm saying? Now, keep in mind that there is a such thing as having a tension headache or cluster headache. Something like that. There is something to that. A lot of times with those, though, there may be an underlying condition. You see, it can be an infection like sinuses. It also can be some form of vascular disorder, okay, or malignancies, cancer, okay, vascular, dealing with your veins and different things like that, such as stroke, headache. Pay attention. I have a story. I was in the emergency room. This was my second job as a registered nurse. And one day, this whole side of my face became numb. I'm talking about numb. And so I'm like, what is going on? Why is my face so numb? I'm in the emergency room, right? They sent me to the urgent care. And I thought maybe I was having a stroke, but she said, no, you're having a migraine. So migraines can mimic a stroke. See, this is why, y'all, it is so imperative to know your education when it comes to these symptoms, y'all. Don't play with these symptoms. I got a headache. I think I'll be okay and just rest. You may not wake up. It is so important when you having these symptoms to go seek medical care. Okay. I'm not saying that you can't take herbs and things like that. That's perfectly fine. But there's sometimes you got to give some medication to help you. Okay. And so that's the issue with me. That doctor, I'm going to tell you what that doctor told me. I was in the emergency room for like over a year and a half. The doctor said, you need to find another occupation because working in the emergency room is going to kill you. You are stressed. It's got you stressed. You're coming in, you nauseous, your anxiety is so, it's fast going. At that time, I was over the clinical decision unit. This was the unit that when the people come in the ED and they're waiting to go upstairs, they will come to that unit. And I was also oversight. So I was a charge nurse over two different things, and it was stressful. I loved what I did, but I didn't realize that it was still affecting me. So I had to look into something, and I did. I went into case management, and I've been in that ever since, thank God. But that's why it's important for you to really, really pay attention to the symptoms that you might be having in regards to a migraine. Now, it says common migraine symptoms that patients will have, okay? Typically, it'll be unilateral or bilateral throbbing or pulsating pain that worsens with activity. But there's also sensitivity to touch, difficulty understanding and expressing speech, dizziness, speech difficulty associated with muscle weakness. Speak difficulty associated with muscle weakness. Fatigue, irritability, motor weakness, nausea, vomiting, neck pain, burning sensation, sensitivity to sound and light, ringing in your ear, visual disturbance. You ever been seeing something and you see and it's something like a black spot or something like that, or like a little something, you look, you know what I mean? But you wondering what that is. That can be a sign that you are actually starting to have a migraine. So those are definitely symptoms that you must pay attention to and do not ignore, okay? Please, people, I can't stress this enough. People in the sky listening too. Have you a journal? Journaling is so important because it's going to tell the story in the time frame of whenever you're having whatever symptom. So write down in the journal. If you're feeling something, write it down. So when you go to the doctor, you could say, okay, last week I felt like this. And then 2 days later, I felt like that. It's a way for you to capture your symptoms in time. You see, because time gonna keep going. But if you're able to write down what's going on, you're actually stopping time for the time that you're writing down what's going on. And then you can present that to your doctor. So your doctor can be able to say, okay, so this has been going on, and it can provide you with a better diagnosis. You see what I'm saying? A more accurate diagnosis. So it's good to keep a journal for when you have diabetes, when you have high blood pressure, migraines, any kind of symptoms that you're having. Don't ignore your symptoms. Please, y'all, don't ignore your symptoms. It's okay to say, oh, I got a headache. I'm just going to lay down for a little bit. But if you constantly keep having headaches, something may be underlining going on. And it could be stress. It could be stress. It could be some things going on in your life that you got, you know what I'm saying? It also can be, let me see here. It says approximately 70% of those who experience migraine are women. 70% of people who experience migraines are women. It's prevalent and it peaks in patients between ages 25 to 55 years old. Woo! Let me read that again. 70% of those who experience migraines are women, and is most prevalent in patients between the ages of 25 to 55 years old. Migraine triggers, pay attention to this, are fatigue, alcohol use, stress, lack of sleep, caffeine intake, certain foods that have preservatives or additive, you ain't eating and you missing meals, physical activity, weather and altitude changes, your menstrual cycle, some medications, and overuse of acute migraine medications such as Excedrin, stuff over the counter and stuff like that. Knowledge of risk factors can help guide your intuition, but assessment and history are key. Woo, I love this stuff, y'all. That's why I get excited with this. Let me read that one more time. Knowledge of risk factors can help guide your intuition, but assessment and history are key. Didn't I just say write down stuff? Didn't I say write stuff down? History. What's in time? How many times you having a migraine? When you're having a headache? What time are you having it? When you do have that migraine, think about, what did I eat? What was going on? Was it my sinuses acting up? Did I drink too much wine? Ladies, you know how we do. We drink some wine to cool down. You see what I'm saying? So it's important for you to know those risk factors and keep track of those things and present them to your primary care doctor or specialist so that they are able to properly diagnose you and treat you appropriately. When I first had migraines, I was put on, God, Lord, what was that medication? Lord, I couldn't take that. I couldn't take it. That medication had me feeling, I forgot what it was. But now I'm on Firaset. But that first medication that they put me on, y'all, I'm going to tell y'all next time. I can't remember it, but it worked, but it made me feel paralyzed. I didn't like it. I said, I can't do this. It's making me feel like I can't even move. I don't like that. But that's what I'm saying. We got to pay attention to the signs, the symptoms of migraines, and we also got to pay attention to the risk factors. What is causing this? For any type of condition you have, there are risk factors. So what is causing this, and what do I need to do about it? And so you also can have nausea as well. I think I said that too, nausea and vomiting with that as well too. And typically the American Headache Society, and y'all can Google that, American Headache Society has created specific criteria to help providers diagnose migraines. So that is something for providers. However, you can also look it up too. That's a creditable resource. It's the American Headache Society. Okay. I hate when somebody calling me and, come on now. So the American Headache Society, you can see some of the criteria to help the doctors diagnose you and that type of thing. And something else that I just said was about seeing spots and sparkles or flashing lights. You see what I'm saying? Something I can't watch is those flashing lights. Y'all know how people have those lights, and sometimes they tell people who have seizures not to look at that kind of stuff. I can't look at that kind of stuff when I got a migraine, or if I don't, because it'll trigger a migraine. So right here, it does say the American Headache Society estimates that 1/3 of patients with migraine experience an oral or focal neurologic symptom, seeing spots, sparkles, or flashing lights before migraine pain begins. Let me tell you something right here. What I know is what I got to tell you. You heard what I'm saying? Didn't I say that? Some of the auras, boy, I'm trying to tell you what I know. Okay, there's also physical sensations such as numbness or muscle weakness. When patients present with these symptoms, assess whether the type of aura the patient experiences and mimics any red flag disorders. Okay, so when this happens, the doctor may want to do some additional tests to see, is this truly a migraine, or is there an underlying condition going on there? Okay. And that's why, people, it is important, y'all, to get your physicals, okay? It is important to get your physicals, because with your physical and your pap smears, women, men, getting your prostate checked when it's time, getting your colonoscopies, endoscopies, it's important to get these things. Reason being is because it's all to help preventative. That's what they're called. So that if there is something going on, the doctor can hopefully find it early in the early stages and be able to treat it so it doesn't go any further. All right. Please, when you're having a pain, a constant pain, discomfort, or anything, and it's not going away, and you've been trying to use a Tylenol, whatever, and it's not going away, please go see someone, because it can definitely be a serious situation. Okay? That's all I'm saying, y'all. I really love what I do, and I want to be able to come on here and discuss these things with you guys, give y'all this information, so that you'll have something to actually think about. You understand? And like I said, this will be put up on other platforms, my YouTube. It'll also be put up on my Facebook, as well as my Instagram, so that people can go and look into it. Okay. It's very important. All right. To do that. And what I'll do is I'll make an announcement. I'll make a post with all of my, my YouTube. You can look in my bio and click on there for my YouTube. Okay. But for Instagram and Facebook, I'll make a post so you guys can be able to go there and look at it too if you would like. But if you go on my bio, you definitely will see, click on it, and it's going to take you to my YouTube, and I'm going to have this uploaded. Now, keep in mind, I'm going to try to get this uploaded today because I will be on vacation until next week. But I will be doing this type of segment with different health conditions and things like that as well. If there is something that you would like for me to discuss, please don't hesitate to send me a DM, and I will be more than happy to talk about it and everything. Okay. So definitely, that's something also. If there's something that you're thinking about, that you have a condition or something like that, and you would like to talk about it or get more insight about it, just send me a DM, and I'll be more than happy to research, and we could definitely have a conversation about it, because that's what it's about. It's about, helping you guys, empowering you, allowing you to keep your dignity when you are at the doctor's appointments and things. But overall, just making sure that you are being healthy mentally, physically, and spiritually. That's the main thing. Okay. No judgment, because we all done been through stuff. So there's no judgment. I'm never going to treat you a particular way or anything about whatever you discuss when it comes to your health. I'm never going to judge you on that, because I just stopped drinking sodas. It's been 6 days. Lord knows it's been hard to me, because I don't went to give me something to eat, and I had to get a Minute Maid. Minute Maid lemonade, and Lord knows I wanted that grape Fanta that was sitting right beside it. But God said, you better get that Minute Maid. You done did 6 days. Keep on going. So trust me, it's hard, eating right and doing stuff, but I'm doing it because guess what? That's self-motivation. Self-motivation. Okay. So if you on a journey of trying to eat better and stuff, do things in moderation. I still eat my fried chicken and my chicken fried rice. I'm getting there, but right now I'm starting with the sodas. You see what I'm saying? Do things in moderation. You see, don't push yourself too hard because sometimes you'll take you backwards. When you're trying to eat right, but you ain't eating right, and then next thing you know, it's something else. Try adding sister water to your Minute Maid. Okay, then, love. I sure will. Thank you for that. I appreciate it. What's your name? Elise? Elise, let me see. I can't. Elise, happy place, girl. That's Elise, happy place. Thank you so much. I sure will, and I appreciate everyone. Because I got some things to do. I got some calls to make and everything. I'm not going to take any additional questions or have people come up today, but moving forward, I will, so we can have a discussion together about this, and this will be a safe space, and we can definitely talk about it and help each other out because I think it's important. I really do. Okay, listen, we got enough people on these social media streets that do mess. Let them do mess. Okay, I ain't doing no mess. You know what I want to do? I want to empower people through health and wellness. That's what I'm gonna do. So, and it'll grow. But I ain't worrying about the mess. I'm gonna let the people who do the mess do the mess. Now I ain't gonna lie. Now I do watch the mess sometimes here and there, but me, I'm focusing on health and wellness. Okay, so this was my first time doing this, y'all. Yay! What y'all think? I did good? Did I do good? I just said, let me just do it. You know what I'm saying? I was like, let me just do it. I ain't even gonna worry about it. I ain't gonna, I'm not even nervous, y'all. And I'm just proud of myself, y'all. I'm so proud. I'm not gonna cry, but I'm so proud of myself because I done been through a lot. You know what I'm saying? And to see where I'm at now, how I feel so good and how I'm in love with myself. I am in love with myself. Woo! That is, man. I'm so grateful to God. Man. It just feels so good, y'all. It feels so good. Thank you, Ansley. It does. Y'all don't understand. I done been through some things, Lord knows, but I'm here. God kept me here for a reason, and I am going to do his work no matter what. And this is what I feel like he want me to do. You know what I'm saying? This is what he feel like he want me to do. But also, I do have a boutique. It's called shoppershesaid.com. I got to throw that in there, a little commercial. You know what I'm saying? That's in my bio, too. I ain't going to do too much because y'all can see that as well. But thank y'all so much. Everybody in the room, everybody in the sky. Me and you will never part. My Tiana, keep my sister away from me. Thank y'all so much for tuning in. I will be doing this next week and moving forward. I'm trying to be more consistent. But y'all continue to enjoy your day. Have a wonderful rest of the week. I'll be going live and stuff on my vacation because I got some things to show. But other than that, y'all just have a wonderful day. Have a safe day and continue. Don't let nobody steal your joy. Have a wonderful week. Happy Memorial Day. And I will check y'all later. Okay. Peace and love. Thank y'all so much. Bye. Bye, Grandma.